The Tripledemic was top of mind for many over the Thanksgiving holiday as cases of COVID, flu, and RSV have already been on the rise this fall. But health experts say they were expecting to see even more of an increase following holiday gatherings. Here to tell us more about this is infectious disease physician Dr. Dean Winslow of Stanford Health Care. Doctor, thanks so much for joining us.
No, thank you for having me.
So first, how is the situation at your hospital right now, and how concerned are you about hospital capacity?
Yeah, so right now in our adult hospital, we're doing okay. We've actually expanded the number of beds over the last couple of years. Again, we're not in great shape, but again, it could be worse. Unfortunately, the pediatric hospital, I just checked with my colleagues yesterday, and they're still very much impacted, particularly by RSV cases. And I think the last count, they've got about 36 children hospitalized with RSV.
Yeah, so many kids are suffering through that right now, as well as their parents. Now, let's get to COVID for a moment. This is the third holiday season since the start of the pandemic. Do you expect to see another COVID surge like we saw last year when Omicron came through? Or do you think vaccinations and infections will kind of blunt this effect and it won't be as severe?
Well, I think, again, just in general, as we get into the colder months of the year, in the Northern Hemisphere, we're going to see more transmission of respiratory viruses. My sense is, though, it's not going to be to the degree that we've seen, in past waves of COVID-19. And again, as you pointed out, that probably the fact that a large number of people have at least received partial vaccination against COVID-19, as well as so many people, unfortunately, have actually been infected by it, that I think these are all factors that are, mitigating against perhaps having as bad of a wave as we've had in the past.
Health officials, of course, urging everyone to get that updated COVID booster shot, as well as the flu shot, and continue to wear masks around large crowds. Is there anything else we can do to keep ourselves and loved ones safer this holiday season? I mean, should we still be social distancing? Should we still be testing every single time we go visit grandparents?
Yeah, again, those are all things where, they're not unreasonable to do. I think personally, myself and most of my colleagues, we're still wearing masks when we're in crowded indoor environments. They're not perfect, but they do provide some degree of protection. And as you pointed out, though, the single most effective thing is to really be sure that you've been fully vaccinated and boosted with COVID-19. And also that you've had your flu shot. And for those of us that are a little bit more senior, again, there's actually a high-dose flu vaccine that's now available that's even more effective than the regular flu vaccine. So I think those are the two most important things that I would recommend.
I want to go back to RSV there for a moment because it's definitely top of mind for a lot of parents and schools right now. What is the difference between RSV and, say, the common cold?
Well, so actually RSV can produce common cold-like symptoms in particularly adults who are, otherwise immunocompetent or have intact immune systems. But the big threat with RSV is that it causes a very serious condition called bronchiolitis, which means inflammation of the small airways, particularly in young children, less than 2 years of age, and it can be even fatal, particularly in premature infants. And unfortunately, we do not yet have a vaccine for RSV, although a couple of them are in development right now. So again, the latest figures that I saw from Lucille Packard, about 90% of the cases were in children less than age 5, and about 50% were in children less than 2 years of age.
All right, Dr. Dean Winslow with Stanford Health Care. Thank you so much for joining us.
Thank you. And again, all the best.
You too.